Welcome all to Mock Test Answer Key Explanation Series for Government Nursing Officer exams. This discussion includes nursing applications, rationale of answers, and important memory tips. This video will help you to avoid confusion in exam hall and perform better in your upcoming exams. Let us go to the important MCQs, answers, and explanation session. Welcome back to the Mock Test Answer Key Explanation Series. Next question. In which condition oral pills should not be given to a woman? Option A, vaginal infection. Option B, asthma. Option C, hypertension. Option D, menstrual problems. The right answer is hypertension. Let us quickly go through the contraindications for oral contraceptives. The memory tip here is BBHHCLD-MAP. That is from the first letters of these contraindications. BB is for blood clotting and breastfeeding. HH for heart disease, hypertension. CLD is for cancer, liver disease and diabetes. MAP is for migraine, age being under 16 or 50 years, and P is for pregnancy. Next question. Double sign is seen in option A, acute pancreatitis, option B, methacolon, option C, duodenal atresia, option D, Caroli's disease. The right answer here is option C, duodenal atresia. We can see the double bubble sign here in this X-ray image. Double bubble sign, duodenal atresia. The D is highlighted for the memory. An ultrasound during pregnancy as well as an X-ray after birth shows double bubble. This is the ultrasound image during pregnancy and this is the X-ray after birth. Both these images showing a double bubble for duodenal atresia. Next question. What are the immediate side effects of electroconvulsive therapy or ECT? Option A, temporary memory loss and confusion. Option B, fractured and dislocated bones. Option C, myocardial infarction and cardiac arrest. Option D, permanent memory loss and brain damage. The right answer here is option A, temporary memory loss and confusion. The side effects of ECT most commonly found is nausea, headache, fatigue, confusion and temporary memory loss. So the memory loss is temporary. So the right answer is option A, temporary memory loss. Next question. Dengue fever is caused by option A, Toga virus, option B, rotavirus, option C, Lissa virus, option D, flavivirus. The right answer here is option D, flavivirus. Let us see the explanation. Dengue is caused by the virus of Flaviviridae family or flavivirus. Yellow fever, West Nile fever, tick-borne encephalitis also caused by this family of virus. So, dengue, yellow fever, West Nile fever and tick-borne encephalitis is caused by flavivirus. Toga virus is causing rubella or German measles. Rotavirus is causing diarrhea. Lissa virus is causing rabies. You can see the memory tip here. Dengue flavi, rubella toga, rabies lissa. Next question. The Brodmann area number that corresponds to the primary visual cortex is option A 3, option B 17, option C 41, option D 4. The right answer here is option B 17. Let us see the diagram showing different areas of brain, different Brodmann areas in brain. Let us see some important Brodmann areas related to this question. 1 to 3, area 1 to 3 is primary somatosensory cortex. Area 4 is primary motor cortex or precentral gyrus. Area 5 is parietal cortex. It is a subdivision. Area 6 is premotor cortex. So you have to remember at least these important first areas so that you can answer the question with elimination technique. When we have another video coming related to this topic, more details of the other areas will be explained. Let us go to the next question. The type of pelvis which is of heart shape is termed as option A gynecoid pelvis, option B anthropoid pelvis, option C antroid pelvis, and option D platypelloid pelvis. The right answer here is option C antroid pelvis. The types of pelvis you can see here. Gynecoid pelvis is 50% in number and it is round shaped. Antroid pelvis is 20% in number and it is heart shaped. Anthropoid pelvis is 25% in oval shape, and platypelloid pelvis is 5% which is in flat or kidney shape. The tip here is GRAHAOPF. That is gynecoid is round shape, antroid is heart shape, anthropoid is oval shape, and platypelloid is flat shape. Next question. Which sampling could be effective during a sampling frame is difficult to identify in research? Option A quota sampling, option B convenience sampling, option C purposive sampling, and option D snowball sampling. The right answer here is option D snowball sampling. Let us see the non-probability sampling methods. Purposive sampling is the sampling which require to have a clear and well-defined criteria or purpose for selecting participant based on their characteristics, knowledge and experience. So here in purposive sampling, some particular characteristics. For example, if you are selecting some top 5 students in each class, so all the students are with good academic performance. That is a characteristic. So this kind of characteristics you will select. Convenience sampling involves recruiting individuals primarily because they are available, willing or easy to access or contact on a practical level. So when the individuals are available, that time you will select. So that is practical level sampling, that is convenience sampling. Quota sampling, it is classifies a population into categories that aims to obtain a desired number of subjects from each category. So in this sampling, you will have quotas. So just like reservation, you will have each category some particular number. Snowball sampling technique relies on the availability and willingness of initial or existing refer or introduce others. So first you will start with the willing or initial existing participant, then it will be referred to the other. So this is the snowball type of sampling. These all are the non-probability sampling methods. Next question. A phobia in which there is irrational fear of birds is option A ornithophobia, option B ophidiophobia, option C oculophobia, and option D cyanophobia. The right answer here is option A ornithophobia. Let us see the different phobias related to this question. Ornithophobia is the phobia of or the fear of bird. Ophidiophobia is the fear of snake. Oculophobia is the fear of crowd, and cyanophobia is the fear of dogs. Next question. Dilatation and insufflation, D and I, diagnostic method for determining whether the fallopian tubes in the human female are occluded is called option A Romberg test, option B Rothera test, option C Rubin's test, and option D red reflex test. The right answer here is Option C. Rubin's test. Rubin's test is the dilation and insufflation test, which is for the fallopian tube patency. The other tests are Romberg test is measuring a person's sense of balance. Rothera test the urine for presence of acetone. Rubin's is D&I, dilatation and insufflation of fallopian tube, and red reflex test is testing for the fundus reflex of the eye. So, Romberg for balance, Rothera for acetone in urine, Rubin's dilatation and insufflation, red reflex for the fundus reflex of eye. Next question. Which one of the following is the major cause of postpartum hemorrhage? Option A. Atonic uterus. Option B. Thrombin. Option C. Preeclampsia. Option D. Incoordinate uterine action. Right answer is option A. Atonic uterus. Uterine atony is the failure of uterus to contract adequately following delivery. Contraction of the uterine muscles during labor compresses the blood vessels and slows the flow, which will help to prevent hemorrhage and facilitate coagulation. So, the contraction of uterine muscles will give a compression of blood vessels. That's why the blood flow is prevented. In atonic uterus, that compression is not happening, so the blood flow is happening or the hemorrhage is happening. That's why this is the leading cause for postpartum hemorrhage. Next question. Eosinophilic, sharply outlined pathogenomimic inclusion bodies found in cytoplasm of certain nerve cells in which viral RNA is synthesized is option A. Negri bodies, option B. Ashok bodies, option C. Reed-Steinberg cells, option D. Clue cells. Right answer here is option A. Negri bodies. Negri bodies are the eosinophilic, sharply outlined pathogenic inclusion bodies found in the cytoplasm of certain nerve cells. It is seen in rabies. Negri bodies in rabies. Ashok bodies are the nodules found in the heart of individual with rheumatic fever. So, Ashok bodies in rheumatic fever. Reed-Steinberg cells are the large abnormal lymphocyte that may contain more than one nucleus, seen in Hodgkin disease. So, Reed-Steinberg cells in Hodgkin's. Clue cells are the epithelial cells covered by adherent gram-negative rods seen in bacterial vaginosis. Let us see the tips here. Nera, Ashok, Pro, Reed, Hodge, Clue, Bat. Negri bodies found in rabies. Ashok bodies found in rheumatic fever. Reed-Steinberg cells are found in Hodgkin disease, and Clue cells are found in bacterial vaginosis. Let us go to the next question. What is a bacilli calmette-guerin or BCG vaccine? Option A. Toxoid. Option B. Immunoglobulin. Option C. Live attenuated vaccine. Option D. Killed vaccine. BCG, the right answer is it is a live attenuated vaccine. Option C. BCG is the live attenuated vaccine from Mycobacterium bovis. They used to prevent the tuberculosis and other mycobacterial infections. Attenuated vaccine means it uses a weakened form of the germ that causes a disease. Next question. Which of the following is not a lice-borne disease? So, this is a kind of negative word question. Not a lice-borne disease means 3 of these diseases are lice-borne disease and 1 is not a lice-borne disease. So, the right answer here is option B, leishmaniasis. The lice-borne diseases are epidemic typhus, relapsing fever, and trench fever. See the causative organs are epidemic typhus by Rickettsia provansky, relapsing fever by Borrelia, and trench fever by Bartonella quinta. These all are the lice-borne diseases. The vector here is lice. Whereas leishmaniasis or Kala azar is caused by the leishmania parasite and the vector here is sandfly. This is also one of the important question. Frequently asked and repeated question. Next question. Which conventions are followed for skull mirrors and lenses? Option A, Einstein sign. Option B, Newcastle sign. Option C, New-Huygens sign. Option D, Newton sign. This question is based on the name of scientists, so you have to by heart the names. The right answer here is option B, Cartesian sign. Cartesian sign convention is the measured distances are measured from optical center of the lenses. So the conventions are followed for spherical mirrors and lenses. Next question. Which is called as non-probability sampling? You have already seen the question before about non-probability. So try to remember and answer this question. Option A, cluster sampling. Option B, systematic sampling. Option C, stratified random sampling. Option D, quota sampling. The right answer here is option D, quota sampling. Let us see this chart of probability and non-probability sampling method. Non-probability sampling methods are convenience sampling, quota sampling, snowball sampling, and purposive or judgmental sampling. Probability sampling methods are simple random sampling, stratified sampling, systematic sampling, and cluster sampling. Next question. The paraphilia that involves the act of touching or rubbing one's genitals against another non-consenting individual in a sexual manner to attain sexual gratification is option A, voyeurism. Option D, masochism. Option C, frotteurism. Option D, fetishism. The right answer here is option C, frotteurism. Let us see the memory tip here. Voyeur watch, frotter rub, masochist, and others. Voyeurism is getting the pleasure by watching nakedness. Masochism is getting pleasure by self-pain. On the other hand, sadism is getting the pleasure by harming others, harming the partner. Frotteurism is act of rubbing and getting sexual pleasure. Fetishism is getting the pleasure from inanimate objects like clothes or some articles, etc. Next question. The word emotion etymologically means option A, to express. Option B, to stir up. Option C, to test. Option D, to cry. The right answer here is option B, to stir up. The word emotion is based on the Latin word emovio, which means to stir up or move out. Next question. A condition in which unequal pupil size is called option A, aniridia. Option B, amblyopia. Option C, anisocoria. Option D, xerophthalmia. Unequal pupil size. The right answer here is option C, anisocoria. See the terminologies related to eye. Aniridia, absence of iris. See the IRI in both the term. Iridia, iris. Amblyopia, decreased vision in one or both eyes. Anisocoria, pupils of the eyes are different sizes. Xerophthalmia, it is the dry eye with the night blindness. It is due to the vitamin A deficiency. Xero means dry. For example, xerostomia is dry mouth and xeroderma is dry skin. So, lot of points are added in this topic. Vitamin A deficiency is causing xerophthalmia. So, these terminologies you remember with color code and the terms and memory tips. Next question. Which one of the following is the last part of small intestine? You have to remember the anatomy of alimentary canal for this question. Option A, ileum. Option B, jejunum. Option C, duodenum. And option D, appendix. The right answer here is option A, ileum. Let us see the anatomy and let us see the memory tips. Small intestine, DJI. This is the order. Duodenum, jejunum, ileum. DJI for small intestine. Here see the diagram from mouth then to esophagus, stomach, then start the small intestine which is duodenum, jejunum and ileum. Then cecum, rectum, colon, anus is also there for the alimentary canal. Next question. Frog eye is the imaging characteristics seen in option A. Caroli's disease, option B. Anencephaly, option C. Duodenal atresia, option D. Rickets. The right answer here is option B. Anencephaly. Let us see the anencephaly frog eye sign in the ultrasound image given here. This is the frog eye. So remember the memory tip, frog and double dio win rickets. Frog eye is seen in anencephaly. You can see the image here. Double bubble sign we already seen. It is seen in duodenal atresia. That is double dio. You can see the image here. Wincept sign is seen in rickets. That is win rickets. Next question. Which disease is fatal brain disorder that are caused by the prion protein? Option A. Pick's disease. Option B. Mad cow disease. Option C. Creutzfeldt-Jakob disease. And option D. Lewy body disease. The right answer here is option C. Creutzfeldt-Jakob disease. Pick's disease is a frontotemporal dementia, a neurodegenerative disease. Mad cow disease is a fatal brain disease that affects cows. This is not for human beings. So this option can be eliminated straight away. Caused by the abnormal protein called prion. This is also caused by prion, but it is not for the human being. So this is not the appropriate answer. Creutzfeldt-Jakob disease is a fatal brain disorder caused by an abnormal protein called prion. So this is caused by the prion and it is for human beings. Lewy body disease is also associated with an abnormal protein, but that is not prion. It is called alpha synuclein in the brain. So this is related to another protein. So the right answer is Creutzfeldt-Jakob disease, which is affecting a human being's brain caused by abnormal protein called prion. Next question. A genetic condition that affects connective tissue with features of tall, thin body and long, narrow face is option A. Marfan syndrome, option B. Sheban syndrome, option C. Laurent-Lévy syndrome, and option D. Carter-Jenner syndrome. The right answer here is option A. Marfan syndrome. Marfan syndrome is a rare genetic disorder that affects the body's connective tissues. Sheban syndrome occurs in pituitary gland. It is due to the excessive bleeding during childbirth and damage to pituitary. Laurent-Lévy syndrome is pituitary dwarfism caused by the absence of functional anterior pituitary gland. So this is both these syndromes. Sheban and Laurent-Lévy is related to pituitary. Marfan is related to connective tissue. And Carter-Jenner syndrome is immotile cilia syndrome, a defect in the action of cilial lining of respiratory tract and fallopian tube. So Marfan is related to connective tissue. Sheban and Laurent-Lévy is related to pituitary. Carter-Jenner syndrome is related with cilia, immobile cilia lining on the respiratory and fallopian tube. Next question. Which causes Klinefelter syndrome? Or in other words, which of this condition refer to Klinefelter syndrome? Option A XO, option B XYY, option C XX, option D XXY. The right answer is option D XXY. Let us see the explanation now. Chromosome abnormalities. Klinefelter syndrome is XXY. Male has an extra X chromosome. Jacob syndrome is XYY. Male has an extra Y chromosome. Turner syndrome is XO syndrome, that is female with only one X chromosome, unable to conceive in this condition. Chapelle syndrome is XX, X-linked recessive disorder. So the memory tips, let us go to the memory tips. Turner XO, Chapelle XX, Klinefelter XXY, Jacobs XYY. Next question. The leading brain tumor in child is option A, Wilms tumor, option B, astrocytoma, option C, neuroblastoma, option D, meningioma. The right answer here is option B, astrocytoma. Astrocytoma is the most common type of brain and spinal cord tumor in children. Meningioma is the most common brain tumor in adult. So astrocytoma is in children the most common brain tumor, and meningioma is the most common brain tumor in adult. Neuroblastoma is starting with the adrenal gland and it will spread to some other areas also. Nephroblastoma is the Wilms tumor. It is affecting the kidney in children. So Wilms tumor is nephroblastoma. Then meningioma is the most common brain tumor in adult, and astrocytoma is the most common brain and spinal cord tumor in children. So the right answer is astrocytoma. Next question. The optimal head circumference will be 45 cm at option A, 12 months of age, option B, 8 months of age, option C, 4 months of age, and option D, 6 months of age. The right answer here is option A, 12 months of age is the most appropriate answer here. Let us see the chart of head circumference in centimeter according to the age, the approximate range. 1 month 36 to 38 centimeter, 4 month 40 to 41 centimeter, 6 month 42 to 43 centimeter, 8 month 43 to 44 centimeter, 12 month it is 44 to 45 centimeter. So that is the most appropriate answer, 45 centimeter at 12 months, and in 24 months 47 to 48 centimeter with the head circumference will reach. So this topic is winding up now and it will be continued in the upcoming videos. Thank you all for watching this video, and more videos are coming on the way. Please like, share and subscribe for more videos. Thank you so much.